Hello, 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 YouTube world. It's Miss Patty with 4 Year CNA, and I'm joining you today for our live question and answer session, which we do every Thursday at 3 p.m. on this channel. I'm so happy you guys are able to join us. I see a lot of you already in the chat box. So, hi, Marie. Hi, Helen. I'm glad you were able to join today. Hi, Samily. You're learning CNA now. That's so exciting. I'm so glad you were able to join. Hi, Lena. Lena, congratulations. You did a great job. And Marie as well. Congratulations. And stay tuned till the end because I'm going to give you guys a shout out for passing the state exam. Hi, Sunshine. How are you? My day is going perfect. Hi, it's me, Danny. Hi, Mira from Dubai. So glad you were able to join us. Hi, Crow's Nest. And Leah, welcome. So while we're waiting for everybody to come in and kind of get settled and get your questions ready, this is a new format for me. I'm learning technology, so bear with me. As you guys know, technology is not really my friend, but I'm trying to improve it for you guys. So I did that whole intro before you guys started to give you time to come in and get settled. Did you like the intro? If you liked it, leave me a comment below. If you didn't like it, let me know that too, because I really want to try to optimize this program for you. So kind of keep me updated on when I'm making changes, whether you like them or you don't, so that I can know when I'm on the right track. So I want to start off today by, first of all, welcoming all the new people that have come in. So I had a phone call yesterday from a previous student. This is somebody who took my class a couple of years ago, and she had actually moved out of state, and she was going for an interview. And her question was, what really should I be wearing to an interview? And she was interviewing with hospice, and it's a job she really, really wants. So she wants to make the best impression possible. So in my class, I tell students that, there's an old saying, dress for the job you intend to get, right? It's a very old saying. And basically, if you're going to work in medicine, that means that you would interview in scrubs because that's what you're going to be wearing to work. And that's really kind of a good old standby. But there's a big but at the end of that. Because if you're going to wear scrubs and you want to put the best foot forward, make the best impression, those scrubs have to kind of meet some criteria. So you want to make sure that if you are wearing scrubs, that they're neat, clean, pressed, right? They should have some creases in them. Don't just take them out of the dryer and shake them out like we do for work. We want to make a little bit better impression. You also want to make sure that there's no holes or rips or tears or stains. You want them in the best condition possible. And you really want to try to stick to darker, solid colors because those tend to look a little bit more professional. So if you've got what I call the ice cream colors, the light yellows and light pinks and light blues, or if you've got some really cute prints, this is not the time to break those out. You want to try to look professional. So darker colors are best, and it is okay to wear black to an interview. That's okay. But darker colors are going to be a better impression. And if you put a scrub jacket over it, it really kind of helps elevate the look that you're going for. But what really confused her, so I talk about that in class. And so she knew that, right, from taking my class. But what really confused her is her sister was helping her get ready for this interview. And she was really stressing about it, trying to figure out what to wear. And online, when she typed in, online, what do you wear to a healthcare interview or a CNA interview? There's a lot of conflicting information. And a lot of the people out there were saying, don't wear scrubs. You need to be in business professional. So she was really freaking out about this and trying to figure out, okay, well, what's the right way to go? So I want to answer this because I think that some of you guys probably have this same situation, the same concern. I mean, what do you really wear? And the short answer to this is it depends on who you're interviewing with. And that's kind of a really hard thing to gauge. So, in most healthcare settings, wearing scrubs to an interview is certainly appropriate as long as they meet that criteria I talked about a minute ago. But if you want to err on the side of caution, business professional is never the wrong thing to wear. So you can wear business professional clothing. It's perfectly okay for an interview. But what I told her to do, since she had a lot of anxiety, and here's the real issue, right? So if you're going into an interview for a job you really want and you've already got a lot of anxiety and now you're uncomfortable with what you're wearing, you go in there and you're like, I'm really nervous, and all of that's going to show, right? I'm not comfortable in what I'm wearing. Are they judging me? That type of thing. That's going to come through. So if you're more comfortable in business professional, then that's really where you need to go with this. Now, if you're confident in your skill set and confident that you can nail the interview, scrubs is perfectly acceptable. And so here's the reason that I prefer scrubs over business professional. And I've worn both to interviews. I've interviewed in a lot of places in my lifetime over my career, and I have worn both. But here's kind of the mindset that I want you to think about, right? So the person that's sitting there interviewing you, whether it be one person, one manager, or a whole panel of people, they're going to judge you based on what you look like, right? And what you say. So first impressions really do count. Now, if you go in a clinical uniform, scrubs with a jacket, right, you look the part, they're automatically going to be able to see you in that position because it's kind of a what you see is what you get situation. If you go in scrubs when they're interviewing you and you're confident, then they get to see, okay, this is the employee I'm hiring. Now, if you go in business professional, you've got a nice dress on, some heels, your hair and makeup is done, and you look great, they may have a harder time seeing you in that clinical position. They may have a hard time picturing that, and they're not real sure what they're going to get when you show up for that clinical position. However, if they've got a receptionist opening, you might fit the bill for that. And now they're thinking, hey, we may not hire her for the clinical position, but we might offer her the receptionist position instead. Now, if you want to be a receptionist, that's fine. But I'm kind of betting that most of you went to school to get your CNA because you didn't want to be stuck behind a desk somewhere answering phones. So when you go in for an interview, it's not just how you look and what you are wearing. It's how you're going to conduct yourself during the interview. So I know you kind of get hung up on, oh, what do I wear today? And you do need to be concerned about that. But I'd rather you take that time and energy and kind of focus it on not what am I going to wear, but more what am I going to say? If you can go into an interview with confidence, with a ready answer as to why they should hire you. Now, this just drives me crazy. And I tell my students this all the time. This is one of my soapbox issues, right? Drives me nuts. You absolutely know when you go into an interview, they're going to say, can you tell me a little bit about yourself? You know it's coming, right? You've got an interview 4 weeks in the future. You know that question is coming. Be prepared for it. You need to be able to give them a reason why they should be hiring you. Now, this takes a little bit of work on your part. You don't want to go in there and give them your entire life history. That's not relevant. I don't want to say something like, well, I was born in Virginia and then we moved to Maryland when mom and dad got divorced and I went to high school there, but then I left and moved in with my grandparents. Nobody cares. That is not what they're looking for. what they're looking for here is, well, I'm coming out of a background in retail and customer service, but I really didn't feel fulfilled in those roles. So I took a CNA class because I really have a heart for helping others. And I want to really kind of get to know medicine to figure out what direction I'm going. So I took a CNA class. I just graduated a couple of weeks ago. I am certified. I passed the test. And now I'm looking for my first opportunity. And I really feel I'll be an asset to your organization because I am determined to excel. I'll always put patients first. I am a team player, and I pay close attention to detail. So what I may lack in experience, I definitely make up for in enthusiasm. If you go in with that, you could be wearing a burlap sack and you'll still get the job. So it's more what you say and how you conduct yourself in the interview than what you're wearing. So scrubs are appropriate. It's okay to wear scrubs as long as you are not unsure of yourself. If you go in scrubs and you're unsure of yourself and you're unsure of what you're wearing, you're not going to come across very well in the interview. You're going to be umming and ahhing and looking down and fidgeting, and you're just not going to give the interview the proper attention that it deserves. Okay? So don't be as concerned about what you're wearing as you are about what you're going to say. This is your opportunity to explain to them why they have a whole waiting room full of people that they're about to interview for that position. This is your opportunity to tell them why you are better than all of those other people and why you deserve a shot at this particular position. And if you can figure out your own strengths here, polish them up, make them shine, and present them, you'll get the job. You'll get the job. Remember that a big part of CNA work is observation and reporting. So you have to be comfortable reporting things to a nurse to be a CNA. Well, in this case, what you're reporting is your qualifications. And they're going to be looking at that. How good are you at communication? How good are you at reporting things? How concise are you? Are you able to deliver the relevant information? They're looking for cues on how well you're going to treat the patient. If you are talking over the interviewer, not letting them finish their sentences, if you're rude, they certainly don't want you working with their patients. So if you're respectful, if you wait until they stop talking and pay attention to what they're saying and answer that, you'll be great on the interview. It's really not about what you're wearing, although I know that what you're wearing can cause you some anxiety. So if you're more comfortable in business professional, by all means wear that. But it's okay to wear scrubs as long as they're neat, clean, pressed, no holes or stains. Darker, solid colors are best. Scrub jacket over the top is perfect. Okay. Another question I get asked a lot for interviews is it okay to have tattoos showing? Now, tattoos the industry has changed a lot in 20 years. A lot. It used to be that you had to cover all tattoos, not only for the interview, but also for work. It's not like that anymore. People are much more accepting of tattoos. So my suggestion, it's always a good idea to, if you have visible tattoos, to wear a jacket or cover them up, an undershirt or something, to cover them up until you find out what their tattoo policy is. So you always want to be respectful. You're trying to get a job at this place. You're not trying to change that place to suit you. You need to fit into that place. So my suggestion is always to err on the side of caution. Cover everything up until you find out what their policy is. Now, most of the time, the policy is going to be, it's as long as they're not offensive, it's okay. And that kind of gives you your green light, your go ahead. But I wouldn't go in with a bunch of visible tattoos and kind of wave it in their face and, something like, well, you have to accept me as I am. That's not really the impression that you want to leave the interviewer with. Remember, you want to be pleasant and cooperative. You want them to feel like you're going to be a good fit, not just for the patients, but for the rest of the team as well. So the more that you can do to kind of demonstrate that, the better off you are. Of course, makeup is fine. There's nothing wrong with makeup. Your hair should be... my own personal preference is that your hair is not left loose, that it could fall forward and, impact a patient. That's kind of an old nursing principle. So if you have long hair, just, put it up or, secure it at the back of your head or something like that. Wild colors really don't matter anymore. Those fantasy colors, they don't seem to be worried about that either. But makeup should be, just professional. So you want to look as professional as you are able to look, right? Put your best foot forward. Now, what I told this particular student, because she was really struggling with this, and I could just sense her anxiety. And I said, it's okay to wear a business professional. If that's what Google is telling you, and that's what your sister is telling you, and that's where it sounds like you're going to be more comfortable, then do that, because you can sell that better because you're confident. But at the end of the interview, they're going to ask you, do you have any questions for us? Now, this is a great time to pull that question out. I know the interview's over. You're already there. You're already dressed. But if you say something like, I was really conflicted about what an appropriate outfit to wear to an interview like this is. If you could help me from your point of view, let me know what you're looking for. That way, if this position doesn't work out, I know what to do for the next one. And I can make sure that I'm presenting myself accordingly. What that does, right? Presenting a question like that. Of course, it doesn't apply to this setting because you've already had this interview. But what that does is it sends a signal to the people that are interviewing you that you're concerned about how they see you. That means that you want the job. But it also tells them that you are willing to comply with whatever their standards are. That means that you're moldable, you're teachable. And the one thing that we want out of CNAs are CNAs that are able to be directed. So if you're doing something wrong, we can tell you, hey, there's a better way to do this. I'd rather see you do it this way. And you'll actually listen to that, right? We want CNAs in the workplace that are able to take direction. So if at the end of the interview, you ask them that question, first of all, you'll gain information if in case this position doesn't work out. You'll gain that information and it'll help settle that debate within you. But also, it will send them a signal that you are trainable. You are eager to please. And that will probably win the interview. You'll probably get the position. So if anybody that's on this or watching a replay, if you are in a position that you hire healthcare workers, can you chime in? Just leave us some comments below. Let us know your thoughts. And that way, all of you guys that are on this, when you come back and look at the replies, you can actually see from supervisors that are out there hiring what their thought process is on this. And maybe we can put this debate to bed for once and for all. So if you are a hiring manager or an interviewer for healthcare, let us know in the comments what you guys want from our CNAs so that we can help direct them. And CNAs, let us know, in the comments what you've worn to an interview and whether it was successful or not. And let's see if we can help each other through this minefield that is interviewing for clinical positions. So let's see who's here. Leah says, hi, Miss Patty, do you know any information about the CNA license while moving from one state to another? Is it able to be transferred? Okay, Leah, that's a great question. It's one that comes up quite often on these question and answer sessions, actually. But It's all on a state by state basis. There's no one answer that can settle this for you, okay? There's something called reciprocity. Now, reciprocity means that when you move from one state to another, the new state gives you a CNA certification based on the fact that you have one somewhere else. So let's say that you're moving from Florida to New York. You have a Florida CNA. You let New York know, hey, I have a Florida CNA. I want to be a New York CNA. And they say, cool, we need you. Just fill out this form, do a background check for our state, pay a little fee, and we'll give you a CNA certification. You're not transferring it. You still have the Florida CNA certification. You're just getting a new one based on the fact that you already have one somewhere else. That's called reciprocity. And a lot of states participate in reciprocity with a lot of other states, but it's not universal because training standards are different. For instance, in Illinois, there is no clinical test. They don't have to test on skills. They take a written test like everybody else, but they don't test on skills. So if somebody is moving out of Illinois to, let's say, Tennessee may say, I'm not real comfortable with that because you didn't pass a skills test. So if you want to be a Tennessee CNA, we're going to need you to go through the course again. So every state's a little bit different in what they will accept. Your best bet is to contact the state that you want to move to. Try to do it before you move because this can be a lengthy process. And let them know, hey, I am a CNA in this state, whatever state you're a CNA in. What is the process to become a CNA in your state? And let them walk you through the different options. So what you want to look up here is CNA reciprocity, or that's the best way to look it up, or CNA registry, and then the name of the state that you're moving to. Just give them a call. They'll walk you through it. The information that can be found online isn't always accurate because this changes on a very regular basis as states, develop agreements and partnerships, and then those dissolve. So you want to make sure that you check with the state you're going to move to. Don't take the online community's word for it. Okay? So good luck. Ugbami says hello. Kanisha, hi. F. Robertson, hi. Sophie from Kenya, hi. Oh, I'm glad that our videos are helping you. That's awesome. I got to tell you about something real quick in just a minute. Crow's Nest intro was great. Thank you. And Sunshine loves it. Thank you. Lisa says, will not taking rings off during hand washing affect your score? Oh, that is a really, really good question, Lisa. So let me explain this. I tell my students it is best not to wear jewelry for the test. Okay, it's one day out of your life. Leave your jewelry at home. It is best to not wear jewelry on the test. But if you watch my videos, you'll actually see that I have my rings on. And that's okay. You can test with jewelry on. It's not best, but you can. And they're not going to subtract points. But they are going to grade you on whether you wash those areas more effectively. So pathogens, which are all the bad guys, right? The bacteria, viruses, yeast, fungi, all the bad guys. Pathogens need 3 things in an environment to thrive: warm, dark, moist. Well, when you wear rings, so let's talk about my rings here real quick. So I've got these rings on, okay? Underneath these rings, there's no light because the rings block the light. So we have dark. My body is warm. It runs around 98.6 degrees. And underneath this ring is going to be warm because that ring's going to kind of trap it. Now, when you're washing your hands and you get moisture under there, now we've got warm, dark, moist. That is the ideal breeding environment for pathogens. So when you're wearing rings, it's especially important that you wash underneath the rings. So you want to physically move those rings out of the way to wash under them. and then you want to rinse, and then you really want to make sure you dry those areas super good to make sure that you don't have that environment under your rings that would allow bacteria to proliferate. Because the problem is that if bacteria gets under that ring and you don't wash it well, you're going to take that to the next patient, and this can lead to a spread of pathogens throughout a facility. So my own personal recommendation is that you don't wear rings during the test. If you do, make sure you wash under them really, really well. But there's another problem with rings. Way back in my very early career, I actually injured a patient with a ring. So I was changing the linens and a chucks under a very heavy patient, and she fell back onto my arms, and my arms were kind of stuck under her because I was pushing the chucks under. And I really, I had to pull to get my arms out, and I had gloves on, but my ring, the stone of it, actually cut through my gloves and scratched her. And I never want to hurt a patient. That's not my role. I want to be there to help. And I felt absolutely awful about that, but you never know in healthcare what situations are going to occur that, a ring may injure somebody. So from that point on, when I worked in a clinical setting, then the rings either stayed at home, and it's very common for me to not have my rings on when I'm working, or if I felt that I needed them on me, I would put them on a long chain at the beginning of my shift. That way I have the rings on me. They're just not on my hands where they can injure somebody or harbor bacteria. But for the test, to answer your question, Lisa, make sure that you're washing under your rings and watch very, very carefully, because they are going to look at that. Okay. Lena says, I just got a CNA job offer on Friday. Oh, congratulations, Lena. That is awesome. Awesome. Sylvia says, good day to you. I'm glad to be in class today. Well, we're very happy that you joined us, Sylvia. Manilda says, hi, how are you doing? I passed my CNA test last July 28th. Very good. Just want to say thank you for all the skills videos. Oh, that's awesome. Congratulations. I'm going to add you to my list. Hold on one second. MENILDAGOFF. All right. Congratulations. Hi, Jennifer. So glad you could join us today. Bettina says, hi. Jennifer says, on the foot that I work, I think it's supposed to be floor that I work on, psychiatry, we're actually allowed to wear street clothes, but I like wearing scrubs. They kind of make me feel more nursey. I just feel more professional. Yeah. And I actually worked in psychiatric setting, and yeah, our techs could wear street clothes or scrubs. A lot of them preferred to wear scrubs. Absolutely. Let's see here. Lisa says, is it not a good practice to sit the bedpan on a barrier on a side table? Oh, that's a good question, Lisa. Okay, if you guys go watch my bedpan video, you will see that it is the one skill I do not use an overbed table for. Now, the reason for that is mine, not the test. This is mine. That overbed table is where the patient eats. So that is their dining room table. I personally have kind of a hard time putting a toileting item on a dining surface. Now, even with a barrier, to me, it kind of skeeves me out a little bit. So that's not, for me, an appropriate action. So when you watch the bedpan video, you'll actually see that I don't set the bedpan anywhere. I open the drawer, I put my gloves on, I put the chucks under the patient, and then I just get the bedpan out of the drawer and put it under the patient as well. So I don't use the overbed table for bedpan at all. And that's just because, to me, it's pretty high on my gross meter. It's pretty icky. So I don't do that. Now, for the test, there's no problem with it. If you want to put a barrier on that table, as long as you're using a barrier, that's the big key here. Use a barrier. As long as you put a barrier on the table, you can put the bedpan on the table. It's not a problem for the test. It's just a problem for me. So to answer your question, it's fine for the test. You've got to figure out for you how you want to address that for yourself. Okay? Hi, Sharon. Crow's Nest says, I had a question. During the test, do we say the steps we're doing as if we're talking to the instructor or the patient? Oh, okay. So I actually have a video on this. If you go watch my animated videos, it's Do I Have to Talk It Out is the name of it. So during the test, you are going to talk to the patient, not the evaluator. So let's say that you're measuring pulse, okay? And you get like, I don't know, halfway through it and you lose count and you're not real sure where you're at and you've got to start over. Don't talk to the evaluators. They're not the ones that need to know. Trust me, they're smart cookies. They'll keep up, okay? You want to tell the patient. So if I had to restart, I would stop and I would say, I'm so sorry, Mrs. Jones. I need to restart this. I'm going to look at the clock here. All right, and start. Trust me, those evaluators are keeping up. That it's not a problem. You don't need to talk to them. The person that needs to know what you're doing is the one you're doing it on, the patient. So make sure that all of your patient interactions are with the patient, not the evaluator. There's very, very, very little that you should be saying to the evaluator during the test. In fact, in reality, you really shouldn't be talking to the evaluator at all. They should be an invisible viewer of your time with the patient. And I know it's hard for students to kind of wrap their heads around that, but that's really the way it's supposed to be set up, is that you and the patient are having a moment, okay? You're doing a skill. You are going to be interacting. They should just be observing that. They should not be in that interaction. But this really applies to out there as well, clinical life, right? Because your career is not about the test. It never will be about the test. Yes, you got to get through the test to get to your career, but your career is going to be way longer than this one-day test. So when you're learning this, it's not that you're learning it to pass the test. You're learning this because when you go out there and you start working, let's say that I'm the patient laying there. If I don't know what you are doing, I'm going to be very resistant because you are a stranger to me. I'm in a strange place, surrounded by strange people, you. And I probably don't have family there all the time. So I'm feeling very vulnerable, very alone. And the one place I want to be at home, because that's where we all want to be when we're not feeling well. I want to be at home, but I can't. So I'm feeling a whole lot of anxiety. So when you are working with patients, I want you to try to remember that their experience is way different than yours. You're there for another day on the job. Clock in, do my work, clock out, go home. It's very routine to you. You know, it's not going to have the impact on you that it does on them. So remember that you are seeing this patient on their worst day. So we need to try to do what we can to put them at ease. So I'm going to tell them everything I'm doing. If I'm opening a drawer to get a toothbrush, I'm telling them I'm opening that drawer to get the toothbrush because their cell phone or their wallet might be in that drawer and they might be very concerned about what I'm doing with their belongings. So tell them, okay, I'm going to open the drawer and get your toothbrush out. There's nothing wrong with that. In fact, it's probably a good practice to get into. Remember that you are in their space. They're not in your facility. And if you kind of rearrange your thinking like that, talking to the patient becomes very easy, very effortless. So yes, you should do that on the exam as well. All of your interactions should be with the patient. But I had a comment that showed up right before I came live. Somebody put a comment on one of my range of motion videos. And the question was, do you have to say flexion extension, or can you just say, I'm lifting your arm above your head like you're asking a question? And that's a great question. You don't have to use medical terms. In fact, I would prefer you not use medical terms with patients because it's a strange language with them. Can you imagine how anxious you would feel if you had surgery somewhere and you're unable to move on your own very well and you can't really defend yourself very well, and somebody comes along and they say, okay, I'm going to do flexion extension now, and you're automatically thinking, oh my gosh, is this going to hurt? I'm afraid of this, you know, and we don't want that reaction. We don't want the patient to feel like we are going to do something strange or exotic to them. We want them to feel as comfortable with us as they do with their own family. So telling them, all right, Mrs. Jones, I'm going to lift your arm up above your head and back down to the bed like you're asking a question. That's something that they can immediately relate to. Everybody has lifted their arm up to ask a question. They know what that is. That doesn't hurt. Okay, fine. Do what you got to do. I'm good here. And they'll become much, much, much more compliant. So try not to use those really big words with patients. Or if you do, make sure you explain what those really big words mean, right? Sometimes in healthcare, and I've seen this a lot in my career, sometimes in healthcare, we try to make ourselves sound way more professional because we want to be respected. We're trying to get the patient's respect. So we use these big medical terms and we act a certain way. But a lot of times what that does is it actually alienates the patient. It doesn't make them respect us more. It makes them fear us more. And that's not really the reaction I want. So I always try to work really, really hard to make sure the patient knows exactly what I'm doing in a way that they can understand so that they'll relax and let me do what I need to do to help them. Okay? Hope that helps. Let's see here. Jennifer says, the worst two questions on an interview to me are when they ask you, why do you want a job here? And why should we hire you over somebody else? I freeze up, LOL. Yeah, those are tough questions, aren't they? And you really do need that. You know they're coming. So you really do need to have an answer for them. And, you know, the answer to why do you want to work here, you should not say for the paycheck. That is not what they're looking for here. They're saying, okay, out of all of the different places out there that are hiring, why did you pick us? What makes you want to come work here? Is it because you've heard they've got a great reputation? That's a great way to answer that question, by the way. You know, your reputation in the community is very high, and I want to be associated with that. Are you trying to get a job there because it's close to home? That's something they need to know too. Because if you're trying to get a job that's an hour and a half from your house, I guarantee you there's going to be transportation issues. And you're going to miss shifts because you live too far away. You know, cars get flat tires. Cars break down. You run out of gas money. I mean, all of those things happen. Weather's a big one. If you're interviewing for a place that's right around the corner from your house, and that's why you want to work there, is because it's convenient. It's right here. It's next to my house. You need to let them know that, because that just made you move way up the list. Because I know that you're not going to have a hard time getting to work. You're going to be less likely to call off. You're probably going to be one of my most dependable employees, and you're probably going to be the one I call because you're close to pick up extra shifts when somebody calls off. So that's a great answer to that question. You know, I live close by. You have a great reputation in the community. I have a friend that works here that referred me. That's another great question, or great answer to that question. Why should we hire you over somebody else? That's something you have to evaluate yourself. So you all have skills. They may not be medical skills, but you all have skills. Do you pay good attention to detail? Are you able to follow directions? Do you have good time management skills? Now, guys, I'll tell you, that's the one thing I don't have. I have zero time management skills. Organization, man, you should see the chaos that is my office. It's organized chaos, but it is chaos. So I am never going to tell somebody I am a highly organized person. That is just not me. Right? But I do pay very close attention to detail. I'm a great problem solver. I am a team player, and I will work very hard to make sure that your patients receive high quality care within the time constraints that I have. So that's a great answer to that question. But you have to figure out, what are your strengths? Does some of you have fantastic organization strengths? You need to tell them about that. Diffusing difficult situations. So have you worked in a retail setting or food service where you had very difficult customers and you had to kind of diffuse a situation? That is a skill that you have, right? So figure out what are your skills. And then this is the time to polish them off and present them and say, this is what I'm good at and why I think I would be an asset to your organization. Okay. But you do have to kind of think about this a little bit before you go in. Hi, Krista. Hi, Melissa. Hi, Michelle. Hi, Alua. Camilla says, hi, Miss Patty. I'm enjoying your class. You teach in details. Oh, thank you. So, okay, so I know there's a couple more, guys, and I'll get to you in just a second, but I want to ask you guys a quick question. Something that so in my classroom, like this is my office. I'm not in my classroom, so what you see behind me on Thursdays is my office. If you've watched any of my skills videos, you've seen the classroom. So in my classroom, I actually just put a whole camera set up, and I've got a microphone, and it's all like super professional. I'm super excited. It gives me the ability to switch cameras as I'm demonstrating skills. It's so cool. And I'm actually going to be live streaming my classroom classes into my online program. So anybody that signs up for the online program is able to actually see me in my classroom live and interact just like you were there. Because it's through Zoom, so you can send messages just like you were physically in my classroom. But I'm actually thinking about, and I want your opinion, because you guys are the ones that are with me every week, right? So I want your opinion on this. I'm thinking about live streaming one of my classes to the world every single class session. So like I would stream class number 1 out for free to everybody. Is that something that you guys would like to tune into to kind of see what I'm like in my classroom when I'm teaching actual real students that are in front of me? Is that something that would interest you guys to be able to kind of sneak into my classroom and see? It's something that I'm thinking about doing. It will be live streamed into my online course, but for the public, is that something that you guys would like to see on one of my lives, like in my classroom? If that's not something that interests you, let me know and I won't do it, because I don't want to take our live, the live platform, if that's not something that would interest you. But if you wanted to kind of see a sneak peek how I teach in my classroom to my students and be able to interact, that's something that I'm actually thinking about doing. So when you said, I teach in details, I do. In my classroom, I'm very, very detailed in the classroom. So I'll kind of keep that in mind and see if I get enough interest, then I'll definitely stream that out. Jennifer said, Ganelle says, is it Janelle? It might be Janelle. Says, I'm still waiting for a date for the test. Oh, we're going to keep our fingers crossed for you. I hope your date comes soon. Good vibes out to you. Jennifer says, do you know why they call CNAs that work in psychiatry techs? Yes, because in most settings, you do not have to be a CNA to work in mental health. So they call them mental health techs or psychiatry techs. And that's because you can only call a CNA if they're state certified as a CNA. So if you are working in that setting and you have not taken the CNA exam, you're not a CNA. Now, CNAs can work as a tech, no problem. You've got those skills. That's great. But it's not required because most of the CNA skills that we have are not really utilized in that setting. So a lot of what CNAs learn how to do wouldn't necessarily be used in that setting. So just kind of, it's a different term because we can't use the term CNA unless you're a CNA. How many percentage do we have to pass on the question and answer testing? Oh, that's a good question. I can't actually answer that in the time that we have left, but I will put that on for next week. Okay, Alua? I will talk to you about how the written test is graded. So I'm going to write that down at the end of this and remind myself. So Crow's Nest, that helps a bunch. I take my test on the 23rd of this month. Oh, I'm going to keep my fingers crossed. Good vibes out to you. We know you're going to do fantastic. Eniola says, I enjoy listening to your programs from Nigeria. Oh, how exciting. Claudia says, hi, Miss Patty. I have a testing date next week. What are the most common skills that most people get? Well, that's kind of a hard thing to describe, Claudia, because it depends on what state you're in. But you have to be prepared to do all of them, because remember that your career is not about testing day. It's about the day after the test when you actually go to work. So you have to learn how to do all of them, because you'll be needing all of those skills in the workplace. So don't get too caught up in what skills most people get. Respirations is the most common documentation skill. So I would definitely know that one for sure, but that doesn't mean that you're going to get respiration. And it also depends on what state you're in as well. Mary Bowberry, I haven't seen you in a while. I'm a CNA in a CVPCU of 7 months, and my hospital is doing nurse externships while I'm in nursing school. What are your thoughts on new grads going into the CVICU? Oh, I think it's awesome. I think that the experience that you get there is incredible. I really wish that they had those opportunities back when I was in nursing school. Because nursing is now highly specialized. When you get out of school, you kind of have to figure out, where do you want to work? And everything is very specialized now. So getting that experience is awesome. Way back when, we couldn't go anywhere near any higher level nursing unless we had at least a year of med surg under our belt. Well, by the time you get into med surg and you get that year under your belt, they're not willing to take you into those higher levels, because they want you trained. Well, I couldn't be trained because I was too busy getting my med surg experience. So it really was kind of like a catch-22. It was very, very difficult to get into those higher level programs. Now they have all sorts of opportunities out there for new graduates to be able to transition into these higher level, more specialized tracks. So HCA Hospitals does this through their STAR-N program. They'll put you onto a track, whether it's mother-baby or CV ICU or ortho or neuro or whatever it is. So when you get out of nursing school, you sign on with HCA, you go into one of these tracks, and they give you that specialized training. So in nursing school, if you can kind of get an idea, hey, I really like cardiovascular. This is like super cool. I like the heart. I love learning about it. This is the track I want to go. It gives you an opportunity to get into one of these specialized nursing tracks. So I think it's an awesome opportunity. Let's see here. Michelle says, I'm a CNA licensed for 7 years. Oh, very good. I never worked on it due to personal reasons. I need some advice on how to restart my CNA career. I would definitely take a refresher, Michelle, because there's a lot of skills that have changed, and you want to make sure that you're giving the best quality care, and you've probably have forgotten a few things. So certainly take a refresher. That would be my suggestion to you. And then just jump in. Just jump in. Lisa says yes. Oh, everybody says yes. Okay. All right. Well, I'll look at that. I'll look at live streaming one of my classes then, since you guys want to see it. Jennifer says those are great tips on how to answer those 2 questions. You're welcome. You're welcome. All right, guys. I'm so sorry I'm out of time. I can't get to the rest of your questions, but make sure that you come back next week. We're here every Thursday at 3, where I answer your questions on CNA testing, training, and workplaces. And I love to meet up with you guys every week. So let's congratulate all the people this week that passed. Maddie M sent me an email through my contact form on my website to let me know that she challenged this test in Florida. She didn't take any classes, just watched my videos, challenged the test, and she passed. So congratulations, Maddie. Karma Francis, congratulations. Lena Chuodier, congratulations. I probably butchered that. I'm so sorry. Alina, congratulations. Marie White, yesterday tested, and she said that she kept hearing me in her head over and over and over as she tested. So yeah, I will do that. And Manilda Goff, of course, on our live here, let us know that she passed. We got a couple people that tested this week, and they're waiting for their results. So if you know these people, tell them to come back and let us know how they did. Okay, tell them to come back and let us know. So Tiny Jelly Bean, that's cute. Tiny Jelly Bean 2003 tested and is waiting. Masada, Caramel, and Eliz Taylor. All tested, and we're waiting to hear how they did. So we're going to keep our fingers crossed and got some good vibes. I've got a couple people that are also testing soon. So those of you who told me that you're testing soon, we're going to keep you, keep you in our thoughts, crow's nest as well. So, good luck. You guys are going to make fantastic caregivers. I just know it because you've got the right hearts. And I love that you join me every week and let me do what I love to do by helping you guys. So until next week, guys, I'll keep my wheels spinning on how to get this this class live streamed, and we'll see what we can do and let you guys join in because I think that would be kind of fun. So until next time, guys, happy caregiving. Bye.